Live from Studio 5 in New York City, this is the News at 6.
Coming up next tonight, homeless and drug addiction often go hand in hand. Well, tonight, some positive news to tell you about. You're going to see how other homeless people are being recruited as first responders to save lives on the streets, and they're doing it. And welcome back, everybody, to our feature story tonight. You know, we know that America is in the middle of an opioid crisis. People are dying of overdoses at record rates. Many of them are addicts who've lost everything and ended up on the streets. But there is some help, because that's where an organization that we're featuring tonight comes in. Check it out. Dana Archin shows us how.
Sleeping in the cold on a bench, and you learn to sleep with one eye open.
Freddie Cox was homeless 26 years ago, but the dark memories will forever linger. He turned to drugs to numb the mental and physical pain.
It's like a survival thing, okay? It numbs you. You don't feel the cold. You don't think about the threat. You know, all of these things. You don't feel the hunger, because a lot of times I wasn't hungry out there.
Freddie tells us it was a miracle when he connected with CUCS, which stands for Center for Urban Community Services. It's a nonprofit that serves 50,000 at-risk and homeless New Yorkers. In May of 2015, the organization started an opioid overdose prevention program. We sat in on one of their trainings in East Harlem.
We're going to be empowering you all with tools and skills to actually intervene, save lives, and help people get to treatment.
The program's goal is to train homeless individuals and community members on how to use naloxone kits. Freddie and his friend Daniel are among those who have been trained. They go into shelters throughout the city to teach others.
It was perfect for me because, like, I got a lot of help from the system throughout my life when, you know, when things were bad, and, you know, I used to have substance abuse problems and everything. And I always, you know, believe in giving back.
Naloxone is a nasal spray medication that can quickly reverse opioid overdoses. Psychiatrist and CUCS Assistant Medical Director Joanna Freed says it's incredible to see her clients go from having nothing to becoming educators.
One of the great things about working for CUCS is that I get to be part of this team, so I'm not kind of fighting that struggle with my clients alone.
Since the overdose prevention program started, CUCS has trained about 1,000 people to use the naloxone kits. Now, to date, the organization claims to have saved 27 lives with those kits. The organization also plans to keep training more New Yorkers, just like Freddie and Daniel, to use them. In East Harlem, Dana Archin, Fox 5 News.
Dana, thank you very much. We're on this story tonight, and joining me right now is Dr. Tony Carino. He is the Director of Psychiatry for the Center of Urban Community Services. Just saw a great story. Congratulations. Good work.
Thanks so much.
Yeah, this overdose prevention program has been in effect about 2 years. You've saved 27 lives. I think that's wonderful. And you do the training. You help all these people go out, homeless and other individuals, to do it. How do you like doing that?
Well, it's really rewarding.
Yeah.
And we have a great team that goes out into the community, does trainings with homeless individuals that have their own experience of addiction, mental health issues. And it's very rewarding to empower people to be able to do something about this epidemic.
I can see that. I mean, it's really working well. I mean, and you talk to the people that are going out there. How do they feel about being able to save a life and in many ways also giving back to a system that helped them out at one time?
Right. Well, in many ways, they have a sense of loss because they've lost friends, colleagues to this epidemic. And so for individuals to be able to do something about it and really save lives changes how they see things. They're able to give back to the community, and oftentimes they talk about basically saving people in a way that they were saved themselves.
Yeah, I want to hear that. What do they tell you? Because you're there with them, you're listening to them, you're out there many times with them. What are they telling you? How do you feel when you hear their stories?
So oftentimes people talk about a real sense of despair and loss during episodes of homelessness.
Right.
And someone stepped in to help them along the way. And so what they talk about is that they always remember that and always want to give back. And when they're doing better or back into housing or back on their feet, it's really empowering for them to be able to give back. And
it is
really
empowering,
identify.
because now they're on the other side. Now they've got something to do, and they really feel right about this thing. Giving back to the system is very important, but you know, they're teachers now, they're counselors, and you're teaching them what to do and how to do it and come back with success stories.
That's right,
Yeah.
yes. And I think they have, you know, homeless individuals have many risk factors that put them at risk for opioid overdose overdoses, including trauma, mental health, and addictions issues. However, this provides a way to really address that. We're also able to provide treatment right after opioid overdose reversals for people, to provide medications like buprenorphine and treatment in the community so that you can get to the root cause of the overdoses, so people are less likely to overdose in the future.
And I know you're getting a lot of good feedback, you know, from other groups and other cities. Tell me about your expansion program, because I know you want to do that.
That's right. We've really focused on the most vulnerable and hardest hit community in New York City, but we'd also like to expand further so that we could train many more individuals in different community settings so that people can have naloxone and this life-saving tool in all communities and really use this in the future to help people.
You know, it's nice to talk about a positive story when it comes to drugs. Dr. Tony Carino, thank you so much for joining us today, okay?
Thanks, Ernie.
Keep up the good stuff.
Thank you.